I'm Ian Hill-Smith and I'm one of the directors of the National Minor Illness Centre. I thought it might be useful to explain some of the things that can be done over the telephone in the way of analysing signs. Normally, examination is thought to be not possible over the phone, but in fact you can pick up some signs quite reliably over the telephone, which can be very useful, and determine whether or not you need to see a patient face to face. The most useful of all of these is the respiratory rate, and that has always been the case. And the reason is that if you have an upper respiratory tract infection, it's unlikely that the respiratory rate will change a great deal. Certainly after coughing or having a sort of clearing of the throat, the respiratory rate will change. But generally speaking, in the background, an increased respiratory rate or someone who is breathless, feels breathless, is more likely to have a lower respiratory tract infection. So how can you measure it? Well, it's difficult for people at the other end of a telephone to do everything, so you can do half of it for them. You can do the timing. And it's particularly useful for parents of children because observing someone else's breathing, whether it's an adult or a child, is a little bit more reliable than trying to take your own respiratory rate. The reason for that is that if you concentrate on counting your breaths, that can in itself change the number of breaths you take, so you get an observer error. So if possible, it's nice to have someone else observe the patient, and if that's a child, that's straightforward. So the first thing to ask is, can you see your child breathing? Or in the case of an adult, maybe if you're talking to the patient, ask them if there's someone else who can help out in the home and have a look at the number of times they're breathing. If there isn't anyone else, then the patient is the next best thing and can ask them to do it themselves. So the half of the examination that you can do for them is the timing. So it's useful to have a watch with a second hand or a mobile phone with a countdown timer on it. And you simply say, just count the number of times you breathe or count the number of times your child takes a breath. And I'm going to tell you when to start and when to stop. And you say start and leave them a gap. And after 15 or 30 seconds, depending on how long you've got to do the telephone consultation, just simply say stop and ask them how many breaths there were, and then multiply it by the relevant number and you get the breaths per minute. Now at this point I often get someone in an audience saying, well, hang on a minute, but for children, what about the children who stop breathing, in other words have apnea episodes? That wouldn't pick that up. Well, probably you're going to have picked that up already in the history, and most parents who've got a child who's stopping breathing will have mentioned it and be seriously worried by it, quite rightly. But if you've got any concerns that the child's that ill, then by all means ask about the nature of the breathing and whether they have had any episodes where they appear to stop breathing. So you can inquire about that in the history. Be careful about third-party examination. Now, you may be able to hear the respiratory rate of someone over the phone. You may not have to do it formally. You may think that you can hear the number of breaths someone's taking. If this is an adult patient, though, be aware that they may be taking breaths as I am now in order to maintain a conversation. So that isn't quite the same as the resting respiratory rate. And the second trap for the unwary is if it's a child or another person and you hear them over the phone, just check that the person you're hearing really is the patient and not someone else. Because you might get a younger child breathing faster than an older child who's actually the patient, and you may not know who's in the background. So be a bit careful of that. You can go on to ask about things to do with recession, but it's more tricky than the respiratory rate. You would have to have someone who you felt confident would be able to pick up some signs of respiratory recession. So you could ask them about, is there any indrawing of the neck, under the ribs, in between the ribs? And if you get a positive answer, yes, I can see that. Ask them to describe it so that you can cross-check that it really does sound like recession. Now, the next most useful sign that you can pick up over the phone is pulse or heart rate. Be aware that it's harder in children. It's harder for all of us. It's faster and the pulse is smaller to feel. In fact, in young children, it's often easier to take it by a hand on the chest to feel the heartbeat rather than a radial pulse. But if it's an adult, just ask them to put either fingers or thumb on the wrist near the base of the thumb and just work around until they can feel their own pulse. Now, normally we avoid using the thumb to feel the pulse, and the reason for that is you can, of course, feel your own pulse in your thumb sometimes and get confused. But if it's the patient taking their own pulse, of course, that doesn't apply anymore, and it's perfectly legitimate for them to take it with their thumb if they find that easier. And again, do the stop-start for them so that they don't need to time it. You just say, right, count now. And it's particularly difficult in young children because the heart rate will be faster, especially if they're ill and with a fever. So they'll need to concentrate on the counting, and you do the timing for them. So say start, wait 15 seconds, stop, how many were there, and then multiply it by 4 to get the heart rate per minute. It is worth asking in adults about whether or not it was regular, but you do need to check that the patient understands what that means because it's not obvious. And I often give examples. So I say, well, is the pulse regular? Like bump, 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 bump. Or is it coming and going? Like bump, 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 bump. And if people understand that it's a different rhythm, they may be able to give you that information over the phone. Why is that important with adults? Well, it's particularly important if you're going to be interested in their blood pressure, or indeed if they've phoned about their own blood pressure, having taken it with a home monitoring machine. It's worth checking what sort of machine they're using. It should be one that goes around the upper arm. Most of these machines are quite reliable these days, but if the pulse turns out to be irregular, then that's one thing that can make the readings less easy to interpret because the pulse pressure will change depending on the irregularity of the pulse. And another thing to be aware of with the blood pressure taken by a home machine is that these machines warn us if the batteries are low. But if a patient hasn't got any replacement batteries and is continuing to use the machine and the batteries are in fact very low, you can get unreliable and rather odd results. Temperature is another situation where it's worth asking how the temperature was taken. And if you get an answer, oh, I use one of these head thermoscan devices and it changes colour, then advise the patient not to rely on it. The readings are unreliable and can't be used for medical assessment. You'll never find a doctor or a nurse using them for proper assessment, so they can't be relied on in the home either. If it's a thermometer that was properly used in the mouth, check they left it long enough, or an infrared thermometer in the ear, that's fine. The readings are pretty reliable under those circumstances, but it's worth checking how they took it. Capillary refill time is another one that you may want to try and ask for. Not quite so easy, but cooperative parent, fine. The sign is more sort of used in children, less established in adults. But if a child is unwell and you are concerned and everything else seems to be reassuring, it may be worth checking the capillary refill time. Make sure the parent isn't confused by blanching of rashes. I may start telling you, but my child hasn't got a rash. Just explain that it's a different test. The best way to do it is to ask the parent to hold the child's finger roughly at the level of the heart and encourage the child, saying, we're going to play the white finger trick or something. And you just squeeze the finger, just gently, just enough pressure to blanch it for 5 seconds, and then let go and time how long it takes for the blood to return and the finger to go pink. If there's any doubt, of course, we use central areas such as the sternum or the forehead, and again, just enough pressure to make the skin underneath go white. Take the finger off after 5 seconds and measure how long it takes to come back. In children, it may be easier for the parent to do the central sign first, rather than doing the finger and finding, well, the child's hand's a bit cold, and then you're having to ask them to do it again. And anything over 2 seconds would be of concern, and anything over 3 would be of more concern. So bear in mind that you can assess clinical signs over the phone, but make sure that they are the patient and not someone in the background.